Hi, I would like to invite you to the lecture about shoulder girdle. We will discuss the issues of osteology. In the beginning, let's think about which bones belong to the girdle of upper limb. As the name says, it will be something that will surround the axial skeleton, the spine and ribs. As we see in the picture, we have a posterior view. It will be scapula and clavicle. Next structures will belong to the free part of upper limb, for example, humerus. We will start with a detailed discussion about clavicle. What do you think? Is the right or left clavicle? To decide on it, we need to determine whether we look at the superior or inferior surface and identify the ends of the clavicle. In this figure, we see the superior surface because it is smooth, it has no grooves or protuberance, and the second matter is the ends. We distinguish the sternal end because it forms a sternoclavicular joint, and acromial end because it forms an acromioclavicular joint. The acromial end is more characteristic because it has a more arched shape and is more massive. So we can determine that there is left clavicle. Now we are going to analyze structures on the inferior surface. The first thing is the impression for costoclavicular ligament. It is simply the place of attachment of this ligament on the clavicle. And because it concerns the sternoclavicular joint, it will be located on sternal end of this bone. Next structure is this subclavian groove. This groove is for subclavian muscle. Here. This is the attachment for the muscle that is situated along the clavicle. On the other hand, on the acromial end, there are conoid tubercle and trapezoid line. The names of these two structures are from the two bands of the coracoclavicular ligament, respectively the conoid ligament and trapezoid ligament. Therefore, these two structures of insertion on the clavicle are defined by one name, coracoid tuberosity, this whole place. We go to the second bone of the shoulder girdle, scapula. It may seem strange to you that this scapula seems to hang in the air, but it is very generously covered with muscle attachments that are located on two surfaces, anterior or costal and posterior or dorsal. Places of insertion are also along the borders, medial, superior and lateral, and also on the angles, superior, inferior, and lateral. In clinical practice, it is particularly useful to know that on the level of the inferior angle, there is more or less seventh intercostal space. Let's analyze the structure of the scapula more precisely. Here it is easier to determine the site, because the articular facet is located on the lateral side, while the scapular spine is on the dorsal side. So in this figure, we see the left scapula with anterior view. We describe this whole flat surface as the subscapular fossa, on which there are muscular lines due to the subscapular muscle attachments. It is also characteristic the coracoid process, which produces anteriorly. It will be clearly visible on the lateral view. It is the remains of the coracoid bone that is present, for example, in reptiles and, of course, in birds. As I mentioned, on the dorsal side of the scapula, there is a scapular spine. This spine separates the posterior surface into the supraspinous fossa and infraspinous fossa. It will be important places for muscle attachments. The spine itself begins with the spinal triangle on the medial side and finally ends with acromion here. It will form the acromioclavicular joint. Additionally, on the superior border of the scapula, there is scapular notch here. This is the place of passage of the suprascapular nerve. To complement the image of the scapula, let's look at it from the lateral view. The dominant structure is glenoid cavity. This is the acetabulum for glenohumeral joint. Above it, there is a supraglenoid tubercle, while below an infraglenoid tubercle. These tubercles will be the places of insertion for muscles, so it is also worth to remember them. In this figure, it is also well visible that the coracoid process is directed anteriorly, while the acromion is located at the back. Since we discussed the bones, there is time for connections. The first one will be the sternoclavicular joint. The acetabulum is clavicular notch of sternum, while the head is the sternal articular surface of clavicle. Note that in the joint cavity there is an articular disc that matches articular surfaces and increases the range of motion. Ligaments that stabilize this joint, it is very logical and simple. The first of them is interclavicular ligament, because it just lies between clavicles here. The next is costoclavicular ligament. In this place we have to remember the impression for this ligament on clavicle, and then we are already making it into a whole here. There are also anterior and posterior sternoclavicular ligament. In this way we describe this joint. It should be mentioned that the mobility of this joint is similar to the spheroid joint. However, this is especially evident when the clavicle is fractured. Then the symptom appears when pressing on a protruding part of clavicle after releasing the pressure. It again returns to the previous position. Physiologically, full mobility of this joint is not possible due to the fact that the acromial end forms the acromioclavicular joint. We're going to talk about this acromioclavicular joint. We find here an analogy to the sternoclavicular joint because the articular surface of the acromial end of clavicle is the joint head. Next similarity is the presence of the articular disc and the fact that it is also a spheroid joint. We have two ligaments stabilizing the joint. The first of them is acromioclavicular ligament. As the name refers, it attaches to the acromion and the acromial end. The second structure is the coracoclavicular ligament, which attaches to the coracoid tuberosity. And at the beginning I mentioned this tuberosity consists of two separate structures, conoid tubercle and trapezoid line. And therefore we can separately name the individual bands: trapezoid ligament and conoid ligament. This is an example that it is worth learning from the very beginning, because in nomenclature the rest of information in anatomy refers to the structures in the field of osteology. The last issue in this lecture will be the connection with the syndesmosis of scapula. We will distinguish the two most important and most visible ligaments. The first is coracoacromial ligament, which is located between these two processes and also supplements acetabulum of the glenohumeral joint. Sometimes we call this ligament and two processes the fornix humeri. Second ligament of scapula is superior transverse scapular ligament. It is such a small structure that closes a scapular notch, creating scapular foramen here. It's all in this lecture. It is a very solid base to talk about the humerus, as well as any muscles that attach to these structures. Thank you for your attention. See you at School of Anatomy. Maciej Haberka.